Welcome back to Daytime Ottawa. An important topic we always love to discuss on this show, and that is mental health and how to tackle things. It can be so challenging, and sometimes perhaps we don't have the right perspective in tackling certain things, such as substance use. And I am joined here today to talk about that and much more. Brynna Lemmex is a social worker with the Royal Ottawa Mental Health Centre. Welcome, Brynna.
Hi.
Great to have you here.
Thank you so much for having me.
I mean, this interview really stood out to me because reading the discussion points that you sent along, not necessarily things that I have thought of, in the past myself. One thing that you wrote was, why sober living may not be the best New Year's resolution for everyone. Mm-hmm. Why, Brynna? Why do you say that?
We say that because not necessarily everyone can achieve sober living. We like to view substance use health as a continuum. So some people have no substance use all the way to a diagnosed substance use disorder. So just because you're using substances doesn't necessarily mean it can lead to problematic substance use or all the way to a disorder. And I think focusing solely on the goal of sober living is unrealistic a lot of the time because it's such an ingrained part of our culture, and it's a very challenging diagnosis or struggle to overcome and stop using substances completely.
Right. So then how do you go about then setting sort of those realistic goals that we often talk about, right? Is trying to set realistic goals when it comes to substance use? Yeah,
so a lot of the time when we are having conversations about change, we ask people to set SMART goals. Okay. So SMART is an acronym. So S stands for specific. So that's when we want to put the 5 W's, the who, the what, the why, the where, and the when. So really set out specifically what you're going to be doing. Okay. M is measurable. Let's measure how much we're going to be doing. So if you only want to do one drink, so measure out completely what a drink is, and then also understand what a standard drink looks like. Right. A is achievable. So 80% of a challenge, but 80% achievable, but 20% of a challenge. So it can be something that you can actually do and accomplish. Right. And then R, realistic. Is this something that's going to be working with my everyday life and going to work with my lifestyle and my family and my friends? And then T, timely. Let's set a deadline to review things. So a month, let's review how things are going with your goal of reducing your drinking or not drinking, whatever the goal is, and then see if that's actually applicable to your life. Yeah, because that it doesn't just affect you, and we when we think of substance use, we think of just the person oftentimes, but so many other people are affected. How do you have, what sort of conversation should you be having with loved ones, friends, and family when you're trying to achieve something like this? Yeah, we always like to have people have their support network, whether that be family, friends, partners, trusted colleagues, anyone really that you have a good relationship with, and let them know kind of what your goal is or if you're struggling with something. And if you don't have a trusted person that you want to talk about, we have services at the Royal to be able to help with that. So if someone is struggling with their alcohol or their opioid use, we have our digital front door. So that was a initiative to shift from our walk-in clinic with our RAM clinic, so rapid access addiction medicine, for people to access care. So right now, anyone can just log on to theroyal.ca/accessram, and they can get connected with a clinician to talk about some of their concerns. Yeah, and what a great way to use technology, right?
Exactly. And when we look at, healthcare, of course, has been in the media getting a lot of attention, and rightly so, and having something as accessible as that, right, is incredibly important for people. Yeah. Another thing you talk about is sort of practicing self-compassion, and I'm not sure we really have a good understanding of how to do that in most cases. What are some ways to practice self-compassion? I think it's really important for us to recognize we're only human, and change is hard. We can't make changes and achieve changes instantaneously. We need that support network and having those conversations, and if people could change and sustain change, there wouldn't be services like the many services that we have available out there. So people are not alone with their struggle. We have to lean on our community and our supports. Yeah, and what about, people do find themselves unfortunately isolated, right? Many people that perhaps are going through substance use and are trying to achieve a goal, if they don't have that network, what advice do you give them to sort of just practice on their own? Of course, the Royal has, as you just described, has help available as well. But for somebody at home that finds themselves more isolated, what advice would you give them?
To reach out, social media is a giant platform. You're not alone. There are lots of neighborhood groups out there and community centers. Things are starting to open up with the pandemic. And if you're not sure where to turn to, we also have a partnership with Access MHA, so Access Mental Health and Addiction.ca. And if people are struggling with their mental health, with isolation, with their substance use, and they really don't know where to turn to, and they don't feel the Royal is the right spot at that time, then Access MHA can connect you with various groups, and they have a list of lots of other free resources and contacts that they can get in touch with.
Brynna, how do you think how far do you think we've come in this discussion? I think in the last decade we've made incredible strides, talking about mental health. Are there still challenges? Is it still taboo to many, do you think?
I think with mental health we've come a long way, but when it comes to substance use, I think we still have work to do, and with destigmatizing and using language and just being open and honest that substance use is a major issue for a lot of Canadians. Yeah,
and we saw that in the last election campaign, right? There was a lot of talk, substance use, and unfortunately leads many to be living on the streets and homelessness. Targeting those people is that must be an incredible challenge, right? Because not everybody has access to a computer, to. Yeah. And with our street-involved population, it's really getting them to connect with some of the outreach services and the shelter populations that we work with. But we've been finding that it's not just street-involved people that are struggling with their substance use. A lot of our federal government employees are struggling. A lot of our healthcare workers are struggling. So it really is affecting all folks that are in the world. I couldn't agree more. Brynna, thanks so much for joining us.
Thank you so much for having me.
Again, you can visit theroyal.ca to find out more information. It's the amount of resources available, by the way, on their website is absolutely incredible, so I encourage you to check it out. We'll be back with more after this.